World Aspergillosis 2025. This species, Aspergillus. Aspergillus is filamentous mold that you find everywhere. It occurs in air, in water, in soil, and the spores of this fungal is inhaled in hundreds or thousands daily without it having any effect on us because it is being cleared by the immune system. However, certain group of people, those that are immunocompromised, those with structural lung defects from tuberculosis, chronic obstructive pulmonary aspergillosis, from lung surgery, from sarcoidosis, from non-mycobacterium tuberculosis, from bronchiectasis are predisposed to develop pulmonary aspergillosis. There are two forms of aspergillosis. We have the non-invasive and we have the invasive form. For the non-invasive, we have the primary cutaneous aspergillosis and we have the allergic aspergillosis. Allergic aspergillosis consists of allergic bronchopulmonary aspergillosis, severe asthma with fungal sensitization, allergic bronchitis, and these usually follow hypersensitivity reactions to the spores of this Aspergillus species. For the invasive form, we have the invasive aspergillosis and we have chronic pulmonary aspergillosis. And chronic pulmonary aspergillosis is a spectrum of disease consisting of aspergilloma, chronic cavitary pulmonary aspergillosis, chronic fibrosing pulmonary aspergillosis, and chronic necrotizing pulmonary aspergillosis. Aspergillosis is a common sequelae of TB treatment. In TB endemic countries, treated TB usually healed by forming scars, cavities, or fibrosis, and this usually serves as a needles for Aspergillus to colonize and with subsequent germination leading to the formation of the disease caused pulmonary aspergillosis. There are similarities in which aspergillosis and TB present, and aspergillosis mimics TB symptoms. Based on the symptoms, both conditions present with cough, patient present with fatigue, breathlessness, patient may have hemoptysis, and when you look at the radiological investigations, you find that the patient has we have lung infiltrates, they may have cavitations, they may have bronchiectasis, but however, we have features that may be suggestive of chronic pulmonary aspergillosis. Features such as, based on the system, persistence of symptoms for weeks or several months, or patients may have significant hemoptysis, that is, patients that may have pulmonary aspergillosis. And when you look at the radiological investigations, the imaging, you find out that in the case of pulmonary aspergillosis, the patient may have fungal ball, the patient may have fungal ball, there may be paracavitary fibrosis, and usually in pulmonary aspergillosis, it may affect just lung a single long parenchyma, but occasionally it may be bilateral. And you cannot just use symptoms and radiological findings to diagnose chronic pulmonary aspergillosis. It also involves, there's what we call diagnostic criteria, and this requires the combination of symptoms, abnormal radiological features, and there must be a positive evidence of aspergillus in culture or microscopy with a positive